How eerie would it be to confront not one, but two sinister twins lurking in the shadows of the brain? Meet dementia with Lewy bodies and Parkinson's disease dementia, two facets of the same chilling condition, often more aggressive than Alzheimer's. These creepy twins deceive doctors and lead to drastic declines, with life expectancies dwindling to just 4 years post-diagnosis. What secrets do they hide, and how do they ravage the mind and body so thoroughly? Let's discover their mysteries together. Before the beloved American actor and comedian Robin Williams tragically passed away in 2014, he faced a tough battle with what was initially thought to be Parkinson's disease. He struggled with deep depression, anxiety, and paranoia. However, it was only after his death that an autopsy uncovered the true culprit: diffuse Lewy body disease, a pathological finding related to dementia with Lewy bodies, which had spread widely throughout his brain. This discovery highlights the profound impact of dementia with Lewy bodies, as seen through the extensive protein deposits in Robin Williams' brain. With Robin's story as a sobering example, let's explore the shadowy world of the twin devils whose mother is Lewy body dementia. Lewy body dementia, LBD, is a term used to describe two closely related types of dementia: dementia with Lewy bodies, aka DLB, and Parkinson's disease dementia, aka PDD. Both conditions affect the brain and can cause changes in how a person thinks, moves, behaves, and feels emotionally. They share many symptoms and are believed to be closely connected, forming a spectrum of diseases that includes Parkinson's disease. There are several common features in both DLB and PDD, such as problems with movement — doctors call this Parkinsonism — mood changes, disrupted sleep, difficulty thinking, and sometimes seeing things that aren't there, aka hallucinations. The main difference between DLB and PDD lies in the timing and prominence of these symptoms. DLB is diagnosed when cognitive symptoms, which related to thinking and memory, start at the same time or before movement problems, while PDD is diagnosed when cognitive symptoms begin after the movement symptoms have already been noticed. In research, doctors use the 1-year rule. If dementia starts at the same time or before movement issues, it's called dementia with Lewy bodies. Suppose dementia starts more than a year after movement issues. In that case, it's called Parkinson's disease dementia, even though this rule isn't based on scientific proof. But after dementia develops in Parkinson's disease, the two conditions almost look the same. Both conditions show brain changes, such as specific protein buildups and shrinkage, but these tend to be more intense in DLB. Also, both patient groups will die at similar ages. After death, the brain tissues look very similar under a microscope, suggesting they might share genetic roots or be at different stages of the same disease. LBD is not just a medical issue. It affects many people culturally and socially. For instance, many people have not heard of LBD until they or a family member are diagnosed. This lack of awareness can delay diagnosis and appropriate care, making the journey more challenging for patients and caregivers. Now that we've explored the profound impact of Lewy body dementia, let's travel back in time to uncover its origins. Stay with us, as we'll also delve into the potentially fatal neuroleptic malignant syndrome later in our journey. In the early 1900s, Frederick Lewy discovered abnormal protein deposits in Parkinson's disease patients' brains, later known as Lewy bodies. He first documented this finding in his 1923 book, but didn't explore it further. Decades later, in the 1960s and 70s, researchers like Japanese psychiatrist Kenji Kosaka continued studying these proteins, linking them to a form of dementia named Lewy body disease. Advancements such as alpha-synuclein immunostaining in the 1980s helped show that this disease was more common than previously thought. Throughout the 1990s, international collaboration among researchers from Japan, the UK, and the US led to the establishment of consistent diagnostic methods for what is now known as dementia with Lewy bodies, DLB. This work significantly advanced the understanding of the role of alpha-synuclein in the disease, culminating in refined diagnostic processes by 2017. Lewy body dementia is the second most common type of progressive dementia after Alzheimer's disease. As of 2021, it's recognized as one of the top 3 dementias, alongside Alzheimer's disease and vascular dementia. Historically, diagnosing LBD was tricky because the criteria before 2017 were exact, but often missed a lot of cases. This meant many people with LBD went unrecognized. Awareness and diagnosis are improving, leading to higher estimates of how many people have LBD. Between 5% and 25% of diagnosed dementias in older adults are due to one of the Lewy body dementias. As of 2014, the Lewy body dementias affect about 1.3 million people in the US and 140,000 in the UK. It usually shows up between ages 50 and 80. Interestingly, LBD might be slightly more common in men than women. With a clearer understanding of Lewy body dementia's impact and prevalence, let's delve into the mysterious causes behind this complex condition. Dementia with Lewy bodies is a bit of a medical mystery because scientists haven't figured out exactly what causes it. They know it involves a buildup of a protein called alpha-synuclein in the brain, but why this starts happening isn't clear. Genetics play a role. About 30% of DLB is thought to be inherited, meaning sometimes it can run in families. The same genetic factors can also increase the risk for Alzheimer's and Parkinson's diseases, showing these conditions might have more in common than we thought. Some genes, like APOE and GBA, can affect your risk. For example, one variant of the APOE gene could make you more likely to get DLB, while another might protect you from it. Other risks include having Parkinson's disease or a sleep disorder where you act out dreams. However, lifestyle doesn't affect your chances of getting DLB. You might be at higher risk if you're over 50, have trouble with colors or smells, or have mild memory issues. Dementia with Lewy bodies happens when a protein called alpha-synuclein starts clumping in the brain's neurons, forming Lewy bodies and Lewy neurites. This clumping messes up how neurons work and leads to their death. This is terrible news for the brain because it can affect how you think, feel, and even move or sleep. However, scientists have yet to figure out how these protein clumps cause the damage seen in DLB. There is ongoing debate about whether these proteins spread from cell to cell or appear randomly across the brain. Complicating matters further, DLB also shares Alzheimer's-related issues with tau proteins and amyloid plaques. Notably, problems with sleep, particularly a disorder where people act out their dreams, might start early in DLB because the brain cells that control sleep get hit first. With a better understanding of the pathology behind DLB, let's explore the diverse symptoms that make it a particularly challenging condition to manage. Symptoms of dementia with Lewy bodies. Unlike some other types of dementia, memory loss isn't always one of the first symptoms people notice. Over time, the symptoms of DLB get worse and start to interfere with everyday life. The early stages of DLB, sometimes referred to as the prodromal or pre-dementia phase, can start manifesting symptoms up to 15 years before the more severe dementia symptoms are recognized. Initial symptoms can include autonomic dysfunction, such as constipation and dizziness, hyposmia, a reduced ability to smell, REM sleep behavior disorder, anxiety, and depression. For a diagnosis of DLB, several features must be assessed. These are categorized into essential, core, and supportive features. Dementia is an essential feature and must be significant enough to interfere with daily functioning, not appearing early, but becoming more prevalent as the condition progresses. Core features of DLB include the following: fluctuating cognition and alertness. Dementia with Lewy bodies stands out from other dementias because it causes noticeable ups and downs in thinking, attention, and alertness. These fluctuations can range from a few seconds to weeks. They might make a person seem perfectly fine during a doctor's visit, only to struggle significantly at other times. This can make it tricky for doctors to figure out what's happening. Unlike Alzheimer's disease, which primarily affects memory and orientation, DLB can impair a person's ability to plan, solve problems, and understand space and distance, making simple tasks challenging. Additionally, DLB often disrupts sleep, leading to problems like needing lots of naps, insomnia, restless legs, or even acting out dreams, making nights as tough as days. REM sleep behavior disorder, or RBD. A critical component of DLB diagnosis involves RBD. It is a sleep condition where people lose normal muscle paralysis during dreams, causing them to act out their dreams physically. This might include yelling, laughing, or punching and kicking while asleep. Curiously, about 80% of people with DLB have RBD, and it often shows up years before any other symptoms of the disease. Acting out dreams can be dangerous. People might accidentally hurt themselves or someone else by falling out of bed or hitting something. What's tricky is that many only realize they're doing it once they're injured or someone else notices. This condition highlights early signs of neurological issues. It shows how our brains control our bodies, even when we're not awake. Parkinsonism. Parkinsonism is a set of symptoms that slow down movement, make muscles stiff, and can cause shaking and trouble with balance. It's common in conditions like DLB and Parkinson's disease. People with DLB often have these symptoms, like moving shakily or having a stiff, expressionless face, which affects both sides of their bodies equally. However, they might not be as severe as those with Parkinson's disease. Visual hallucinations. Nearly 80% of people with DLB experience visual hallucinations early on. They might see vivid and detailed images of animals and people, or even surreal scenes like bicycles hanging from trees. These hallucinations can be scary or strange, ranging from tiny people wandering around to ghosts sitting quietly. While some people realize these visions aren't real, others might genuinely believe in their presence, especially as their condition worsens. Some of the key supportive features include sensitivity to antipsychotics. People with DLB can have severe reactions to antipsychotic drugs, which are sometimes used to treat symptoms of dementia. These reactions can increase health risks significantly. Dysautonomia. This is a fancy term for when the autonomic nervous system, which controls heart rate and digestion isn't working right. Symptoms include blood pressure issues, digestive problems, and difficulty maintaining body temperature. Non-visual hallucinations. Besides the more common visual hallucinations, those with DLB might experience hallucinations involving other senses, such as hearing or touch. Sleep and mood issues. People with DLB often experience problems like excessive sleepiness during the day, depression, and anxiety. These can impact their daily life and increase the risk of falls. Motor and physical symptoms. DLB can lead to Parkinsonian symptoms like stiffness, shakiness, and trouble with balance. It also often causes issues with the gastrointestinal system, such as constipation and problems with blood pressure regulation. As the disease progresses, individuals might develop more pronounced psychiatric symptoms like agitation and delusions, which often revolve around themes of persecution or jealousy. They may also struggle with recognizing familiar faces, a condition known as Capgras delusion, where they believe a loved one has been replaced by an imposter. Now, let's explore how these myriad symptoms guide the challenging path to diagnosing dementia with Lewy bodies. Dementia with Lewy bodies, DLB, is a tricky brain disorder that doctors find hard to pinpoint while someone is still alive. Usually, they can only confirm it after someone has passed away through an autopsy that shows specific changes in the brain. When diagnosing living patients, doctors use terms like probable or possible DLB based on the symptoms they see and some tests. DLB shares a lot of symptoms with other types of dementia, like Alzheimer's or Parkinson's disease, which can confuse doctors, leading to wrong diagnoses. This misdiagnosis can cause patients to receive the wrong treatments, adding stress and uncertainty for them and their families. Accurate and early diagnosis is super important, mainly because people with DLB can react really badly to certain common medications used for dementia, which can make their symptoms worse. The latest guidelines for diagnosing DLB include checking for things like changes in thinking and alertness, visual hallucinations, physical actions during dreams, and Parkinson-like symptoms that aren't caused by medications. Doctors use tools like PET or SPECT scans to help spot DLB by examining how certain parts of the brain are working. They might also check for other signs, like problems with heart function or unusual brain waves. A diagnosis of probable DLB is given when a patient exhibits dementia along with at least 2 core features, or 1 core feature plus 1 indicative biomarker. Possible DLB is diagnosed when dementia and only 1 core feature are present, or if no core features are present, then at least 1 indicative biomarker is present. Overall, getting the correct diagnosis involves a lot of detailed checks, including medical history, brain scans, and tests that assess mental function. This careful process helps ensure that each patient gets the right kind of help for their specific needs. Treatment. Dementia with Lewy bodies, DLB, is a tricky condition to handle because it affects thinking, movement, and emotional health all at once. This variety of symptoms means that treatment needs to be super personalized and mainly focuses on relieving symptoms, since there's no cure to stop DLB from getting worse. Treating DLB is like walking a tightrope because improving one symptom could worsen another. For example, a medicine that helps with movement might intensify emotional issues. Plus, the symptoms of DLB can change wildly from one day to the next, making it even harder for doctors to keep up with the best treatment plan. Multidisciplinary approach. A multidisciplinary team approach is crucial in managing DLB. This includes neurologists, psychiatrists, physiotherapists, occupational therapists, and nursing staff, all coordinated to provide comprehensive care. Caregiver education and support are also integral parts of the management strategy, helping improve the quality of life for patients and their families. Medication challenges. Antipsychotic sensitivity is a significant concern in DLB due to the severe side effects these drugs can cause, including potentially life-threatening reactions such as neuroleptic malignant syndrome. It's characterized by symptoms including high fever, muscle rigidity, altered mental status, and autonomic dysfunction, such as unstable blood pressure, sweating, and rapid heart rate. NMS is considered a medical emergency because of its potential complications, which can include kidney failure, respiratory failure, and, in severe cases, death. As many as half of the people with DLB who take these medications could experience severe adverse effects, sometimes resulting in fatality. Thus, the use of antipsychotic drugs in DLB is fraught with risk and often avoided. Other drugs commonly used for treating symptoms in older people, such as tricyclic antidepressants or certain types of sleeping pills, can also worsen DLB symptoms due to their anticholinergic properties, which may impair cognitive function and exacerbate memory issues. Cognitive symptoms. Acetylcholinesterase inhibitors, such as rivastigmine and donepezil, are often used for cognitive impairments and have shown benefits in managing DLB. These medications can stabilize or slightly improve cognitive function or slow its decline. Motor symptoms. Common Parkinson's disease medicines like levodopa don't always work well for DLB and might cause mood and behavior issues. However, newer treatments like the anticonvulsant zonisamide are promising, especially in Japan, where it's used for DLB. Neuropsychiatric symptoms. Neuropsychiatric symptoms like aggression and hallucinations in DLB don't always need treatment. Doctors often start by cutting back on medications that increase hallucinations. If symptoms get worse, they may adjust other medicines, such as antidepressants. Drugs like donepezil and rivastigmine can help reduce these symptoms. However, the effectiveness of other medications like memantine and olanzapine is not well proven. It's essential to choose antidepressants carefully because some can worsen sleep issues. Overall, treatment needs to be customized to each patient, considering their specific symptoms and drug reactions. Sleep disorders. Addressing sleep disorders in DLB involves careful evaluation of all medications that might impact sleep quality. Treatments such as melatonin are preferred due to their safety profile compared to other, more potent sleep aids, which can increase the risk of falls and worsen cognitive impairment. Autonomic symptoms. For symptoms like orthostatic hypotension, where your blood pressure drops when you stand up, doctors usually suggest trying non-medication treatments first, such as changing what you eat and doing specific exercises. Suppose these aren't enough and medicines are needed. In that case, doctors might prescribe drugs like fludrocortisone or midodrine. Still, they're careful with these because we're still determining how well they work for people with DLB. Emerging treatments and non-pharmacological management. Besides just using medication, doctors are getting more interested in non-medical ways to help people with dementia with Lewy bodies. Techniques like cognitive behavioral therapy, which allows patients to manage their thoughts and emotions, and customized physical activities can improve their quality of life. Managing DLB isn't just a one-size-fits-all approach. It's about carefully balancing treatments to see what works best. This means constantly tweaking each person's care plan to handle the ups and downs of the disease, aiming to give them the best life possible. Caring for someone with dementia with Lewy bodies can be incredibly challenging, often more so than caring for someone with Alzheimer's disease. This is because people with DLB experience intense neuropsychiatric symptoms, such as sudden emotional changes, apathy, and sometimes aggressive behavior. They also often have problems at night, like sleepwalking, which can be really tough on a caregiver. Because of these symptoms, people with DLB might become less independent quicker than those with Alzheimer's. Caregivers of people with DLB often feel worn out and might become depressed due to the heavy demands placed on them. Sometimes, other family members might not see the daily ups and downs and don't understand how hard it is, leading to disagreements and added stress for the caregiver. Educating caregivers on how to handle difficult behaviors like agitation or hallucinations is really important. Learning the right strategies can reduce stress for the caregiver and the person with DLB. For instance, if the person with DLB is hallucinating, it's better to distract them or change the subject rather than argue about what's real. Safety at home is also a significant concern because of symptoms like sleep-related movements that could lead to injuries. Simple changes like lowering the bed, placing a mattress on the floor next to it, or padding sharp corners can help prevent injuries. In severe situations where emergency treatment is needed, caregivers need to inform medical staff about the risks of certain medications for people with DLB, as some common treatments can have severe side effects. Driving can become unsafe early in the course of DLB due to visual problems, movement difficulties, and fluctuating mental states. Assessing when it's time to stop driving is critical to managing DLB to ensure everyone's safety. As of 2021, there's no known cure for dementia with Lewy bodies. Early on, DLB can be more disabling than other types of dementia, like Alzheimer's, often leading to more hospital stays and a lower quality of life. Factors like depression and visual hallucinations worsen these effects, and physical issues like low blood pressure when standing can predict a more challenging road ahead. DLB isn't well understood because it's often missed and diagnosed late, making it hard to track how quickly it worsens. People with DLB may keep their memory longer than those with Alzheimer's. Still, they could lose their ability to speak fluently sooner. They also face more mental health challenges early on, which can mean quicker cognitive decline, more frequent moves to nursing homes, and shorter lifespans. The average lifespan after a DLB diagnosis is about 4 years, shorter than for Alzheimer's. The symptoms can make everyday life really challenging and increase the risk of getting hurt from falls or developing serious conditions like pneumonia, which often leads to death in DLB cases. Both people with DLB and their caregivers face a lot of stress and worry due to the unpredictable and upsetting symptoms of the disease. Scientists are working hard to better understand and diagnose dementia with Lewy bodies before it fully develops. They aim to identify early warning signs, known as biomarkers, to initiate treatment sooner, potentially slowing the disease's progression. In 2020, experts introduced new guidelines to recognize early DLB symptoms before significant memory loss occurs. They identified 3 preliminary stages of DLB. 1. starting with mild memory issues, another with abrupt severe confusion, and a third marked by profound mental health changes. A 2017 study discovered unique proteins in the skin of DLB patients that are absent in healthy individuals, hinting that a simple skin test could aid in diagnosing the disease in the future. Additionally, researchers are exploring advanced techniques such as brain scans and specialized blood tests to detect DLB earlier. In the quest for treatments, scientists are experimenting with methods like cognitive training and brain stimulation, previously applied to other neurological disorders such as Parkinson's and Alzheimer's. They are also exploring innovative therapies like immunotherapy and gene therapy, which target the destructive proteins accumulating in the brain. These advancements offer hope that we may eventually be able to control or even prevent Lewy body dementia.